I had to touch the light switch 3 times before leaving the room. Or I felt something terrible would happen.
My hands were raw and bleeding from washing them so many times.
I knew my fears weren't logical, but the anxiety was overwhelming.
These are just a few glimpses into the often misunderstood world of obsessive-compulsive disorder, or OCD. Affecting millions worldwide, OCD is not just a penchant for neatness or a quirky behavior. It's a relentless cycle of obsessions and compulsions that can significantly impact everyday life. Inside OCD. A closer look at obsessive-compulsive disorder. Every narrative of someone living with OCD brings forth the anguish, the repetitive rituals, and the intense anxiety they face daily. For an outside observer, it might look like a mere eccentricity or a stringent habit. But delve deeper and one understands the profound distress and the overpowering compulsion to act in a bid to mitigate that distress. As per the World Health Organization, or WHO, OCD ranks among the top 20 causes of illness-related disability worldwide, for individuals aged 15 to 44 years. Contrary to popular belief, OCD isn't about liking things organized or being a neat freak. It's a serious mental health disorder that affects over 2% of the population, which in sheer numbers translates to millions globally. But why is understanding OCD important? While OCD is heavily stigmatized and misunderstood, it is essential to remember that it's a neurological disorder, and not a choice. Knowledge and empathy towards individuals with OCD become pivotal, given that societal misconceptions can often lead to increased distress, isolation, and hesitance in seeking treatment. Leonardo DiCaprio, an Academy Award-winning actor, is known for his vast range of roles. But few are aware he was diagnosed with OCD. At a young age, Leo started noticing patterns. He felt an uncontrollable urge to step on every chewing gum stain he saw, and felt extremely uncomfortable if he missed one. Challenges like these made school hallways an exhausting maze and extracurricular activities, like team sports, a struggle. His teachers and parents, initially confused, became essential players in identifying and addressing his symptoms. The juxtaposition of a globally recognized actor with the vulnerabilities of a condition like OCD underscores a crucial message. Mental health conditions do not discriminate. They can affect anyone, regardless of their achievements, status, or external appearances.
Disclaimer. This video is intended for educational purposes only, and is not a substitute for professional medical advice, diagnosis, or treatment. Let's now continue our journey to better understand mental health.
The convergence of scientific data and personal narratives like of DiCaprio gains a holistic understanding of OCD. A key finding, reported by the National Institute of Mental Health or NIM, indicates that OCD affects both adults and children. Interestingly, the World Health Organization places OCD in the top 10 most disabling illnesses, by lost income and decreased quality of life. Yet, despite its prevalence and significant impact, gaps persist in the broader understanding and representation of the disorder. One of the prominent gaps lies in the cultural nuances associated with OCD. A study published in the Journal of Obsessive-Compulsive and Related Disorders highlighted that cultural factors, such as beliefs, practices, and societal norms, can significantly influence the expression and management of OCD symptoms. In the realm of academic institutions, educators and counselors might sometimes overlook the manifestations of OCD, mistaking them for quirks or mere habits. Yet another gap is the lack of longitudinal studies that trace the journey of individuals with OCD, from early symptoms to their later years. Such studies are essential, as they can offer insights into the progression of the disorder and the long-term efficacy of treatments. OCD, at its heart, is characterized by two primary components: obsessions and compulsions. Obsessions are intrusive, unwanted, and often distressing thoughts, urges, or images that persistently plague an individual's mind. They're not merely worries about real-life problems, but are excessive fears or apprehensions, such as the fear of contamination or the fear of causing harm to oneself or others. And compulsions. These are repetitive behaviors or mental acts that a person feels driven to perform in response to the obsession. For instance, someone obsessed with the fear of contamination may resort to excessive hand-washing. Diving deeper into the variations of OCD, it's important to note the following behaviors such as checking and rechecking. The compulsion arises from an obsessive fear of potential danger or harm. Symmetry and ordering. The distress arises when things seem out of place. Hoarding. And contamination and cleaning. As to excessive washing or cleaning. Contrary to popular misconceptions, these behaviors aren't rooted in a desire for perfectionism or just a quirk. They are driven by deep-seated anxieties. Diagnosing OCD isn't as straightforward as identifying a physical ailment through a medical test. It involves a thorough assessment, both clinical and psychological. When faced with the vast expanse of OCD, it's natural to feel overwhelmed. But here's a beacon of hope. With the right treatment, countless individuals have found their way out of the shadows, leading fulfilling lives. Here are the suggested treatment options. 1. Behavior therapy. Often termed as cognitive behavioral therapy or CBT. It stands as the most effective treatment for OCD. 2. Medications. As to stimulants and non-stimulants. 3. Integrated approaches. A combination of therapy and medication often brings about the most profound changes. So, for everyone touched by OCD, whether directly or indirectly, here are some parting recommendations and reflections. 1. Early intervention is key. 2. Comprehensive support system as to families, educators, and peers play a pivotal role. 3. Continual education. 4. Celebrate small wins. Every step away from the grip of OCD, no matter how minuscule, is a victory. OCD is complex, multifaceted, and challenging. But if there's one takeaway, let it be this: there's always a way forward. There's always hope. For those navigating OCD's tumultuous waters, remember the words of Dr. Jeffrey Schwartz, a leading expert in the field. You are not your OCD. You are so much more. With determination, understanding, and the right interventions, you hold the power to redefine your narrative, weaving a tale of triumph over adversity.